How's it going, guys? So this is a high yield question for biochemistry for step one. I'll cut to the fucking chase, okay? We have a bunch of fancy descriptors here, but this question is not so bad. I will tell you exactly what you need to know for the exam, all right? So before we get started, please subscribe to my channel. I really appreciate it. And give the video a like. I really appreciate it. And find me on Instagram at Mehlman_medical, MEHLMAN_medical. Link is down below. Find me on Telegram. Recently created a Telegram group and channel. Links are down below. Now, starting this fucking question here, where we have an 81-year-old dude with history of alcoholism. He's had a recent fall. He's not seen a physician in many years. On examination, he has many ecchymoses and abrasions. He has a dentialism, which is a fancy word for loss of teeth. You have to learn some vocabulary for USMLE. That's how it works. Hemorrhagic macules around hair follicles, which means perifollicular hemorrhages. And the question's merely asking the most likely mechanism for his findings. Okay, so we're just going to walk backwards through the answers here. Choice C, inhibition of epoxide reductase, wrong fucking answer. This refers to warfarin. Okay, so warfarin inhibits vitamin K epoxide reductase, which is the enzyme that recycles vitamin K to its active form. There's no reason to assume he's on warfarin here. He has not seen a physician in many years. Presumably, this implies that he's not on any meds that would require routine monitoring. So this would be a big fucking leap to just randomly assume that he's on warfarin, okay? Choice D, disruption of clotting factor carboxylation, wrong answer. This vitamin K is normally a cofactor for an enzyme called gamma glutamyl carboxylase, okay, which activates clotting factors 2, 7, 9, 10, as well as protein C and S. There's no reason to assume vitamin K deficiency here. I mean, that would classic vitamin K deficiency shows up two ways on USMLE, either a neonate who is bleeding at the umbilical stump because the neonates have sterile bowels, or it could be an adult who's on broad spectrum antibiotics for many weeks, who has a loss of gut to normal flora that synthesize vitamin K. So we're just going to keep going here. Diminution of elastin cross-linking capacity means decreased ability for elastin cross-linking. It's not that this is a crazy / outrageous answer. It's more that this is where we need to narrow down based on saying, well, what is going on in this vignette? Perifollicular hemorrhages, you need to know, are classic for scurvy, okay, as well as loss of teeth, easy bruising, okay, so scurvy, vitamin C deficiency. The correct answer is defective polypeptide hydroxylation. Vitamin C is a cofactor for hydroxylase enzymes, and we need hydroxylation when we are synthesizing collagen, okay? So vitamin C, if you have deficiency, we get defective collagen synthesis, okay? Easy bruising, perifollicular hemorrhages, loss of teeth, okay? So defective polypeptide hydroxylation, that's our answer. Choice A, defective glycoprotein that forms a sheath around elastin. This refers to fibrillin, which is Marfan syndrome, okay? You need to know, literally, I'm quoting it right now. Fibrillin is a glycoprotein that forms a sheath around elastin. You should memorize that, all right? So Marfan syndrome, obviously, that's a lengthy discussion in and of itself, but that would be your answer, choice A, for Marfan, okay? You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe to my channel, and I appreciate your time. That's it.